Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about how sleep affects your oral health. Let's start. So today's episode is actually very interesting. We're going to be talking about how poor sleep or sleep disorders affect your oral health. Now, we already know that it has already been established that you need good amount of sleep, right from 8 to 9 hours per day. Also, depending upon the duration, the intensity, and the kind of quality of sleep. Now, it has been proven since time immemorial that good quality sleep leads to good health. That's very important because your overall health depends upon a lot on your sleep. Why? Because most of the most metabolic things that are actually happening are happening during sleep time. Now, if because of any sort of livelihood purposes or any sort of occupational hazards, or maybe just the fact that you like to scroll on social media in the night in front of a blue light screen, you are not sleeping well, there's a high likely chance that you're kind of slowly withering away your overall health and your oral health. So let me tell you what are the effects of sleep deprivation on overall health. It not only increases your chances for metabolic diseases, cardiovascular diseases, hypertension, stroke, sleep apnea, increased BMI, obesity, diabetes, kidney related disorders, and so many other things. You have to understand that sleeping is an absolutely essential thing for your body to go through because it helps you rest during the time that it's supposed to. Secondly, let me tell you what all things happen. When you don't sleep properly, there is a sense of chronic low-grade inflammation happening at the most cellular level in your body, which means that your body is under stress. It is releasing catecholamines, cortisol, adrenaline. At the same time, it is releasing chemical mediators such as interleukin 1, interleukin 6, interleukin 7, tumor necrosis factor alpha, C-reactive protein. All of these are chemical mediators that not only cause oral health problems, they cause big time disorders such as hypertension, such as diabetes, stroke, heart attacks, so many things. So you have to be very careful about it. The main thing is because you're not sleeping or you're sleeping irregularly, it actually kind of clocks off the melatonin cycle and basically your circadian rhythm. That is a biological clock that helps you realize that what time you need to go to sleep and what time you need to get up. This is actually kind of controlled by light and darkness with the help of the pineal gland, and the melatonin hormone is increase or decrease as per the conditions. Now, what happens is when you're exposing yourself too much to blue light, that is screens and desktops and whatnot, phones and everything, late in the night when you're supposed to go to sleep, you are kind of signaling your brain that it's not sleep time, it's not sleepy time, you need to still be awake, and that puts a lot of stress on your body while whenever you get to go back to sleep. I've had personal experiences about it on days when I've actually shut off everything 1.5 to 2 hours before I actually go for my sleep time. I wake up much fresh. Secondly, if you're taking too much of caffeine, if you're taking alcohol might give you sleep, but it does not give you good quality sleep. Smoking, that also, it helps in stimulation of the brain. Now, if you're doing all these things apart from PIU, problematic internet usage or problematic internet use, which is scrolling incessantly, giving you that dopamine rush all the time, you are compromising on the sleep quality in the wee hours or in the late hours of the night, and it is causing low grade inflammation in your body. Now, whatever chemical mediators that I've talked to you about, these are also the disease causing mediators in the oral environment, that is periodontal disease, gum disease, gingivitis, periodontitis, bone loss, tooth loss, inflammation of the gums, bleeding gums, sore gums, dental caries, because of the fact that your salivary flow rate goes down when you are sleep deprived. The salivary amylase goes up, which breaks down all the form of food that is there into simpler carbohydrates, which is also food for the bacteria and the disease causing microbes in your mouth. Secondly, you have to understand that there are two hormones, one is ghrelin and one is leptin. Ghrelin increases the appetite, leptin decreases the appetite, and once you are sleep deprived or your quality of sleep is bad, your ghrelin goes up and your leptin goes down. That means you are more prone to eating, feeling hungry faster, getting more cravings. On top of that, your insulin resistance increases, your fasting blood sugar levels increase, and main thing, you are irritable. There is psychosomatic problems that could happen, even burning sensation that can be associated with lack of sleep. And also you can go up to the extent of anxious disorders, anxieties, depressions, even suicidal ideation. So you have to be very careful about these things. I would strongly recommend that if you are having really big problems with sleeping, get professional help regarding sleep therapy, get a sleep study done. If you are having obstructive sleep apnea, that could be one of the reasons. Otherwise, if whatever you can control your habits, you can control your lifestyle, just do that and try to lead a normal healthy life so that you can sleep properly, recover, and get to work and do whatever that you feel like that makes your life fulfilling the next day in the absolute best way possible. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Just drop me a message with your name, your location, and whatever common oral health problem that's causing you trouble. We'll get in touch with you soon. And if you have any queries, questions, apprehensions, suggestions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.